Good morning. You're listening to Senior Scene on your hometown station, 1430 WNAV. I'm Pam Jordan, Director of the Department of Aging and Disabilities in Arundel County. And with me today is Dr. Eric Bush, who is the Chief Medical Officer with Hospice of the Chesapeake. Welcome.
Great. Thank you. Thank you so much for having me here. Appreciate it.
My pleasure. So I know we have some specific questions today, but tell us a little bit more about Hospice of the Chesapeake. I feel like it's an institution in this community. A lot of people probably know what it is.
Thank you. Sure. So Hospice of the Chesapeake is a not-for-profit community-based organization that provides hospice and palliative medicine to Prince George's and Anne Arundel County. We have two primary locations. One is in Pasadena in Anne Arundel County, and the other one is in Largo in Prince George's County. We do both hospice and palliative care. Maryland, as you know, is a certificate of need state, so our care is limited to those two counties. At some point in the near future, I'd love to serve even larger parts of Maryland if possible. Last year, we served over 3,000 patients on the hospice side, and on the palliative care side, over 700 unique patients.
That's very ambitious, and what a great service you provide to this community. So that leads me into my next question, because I think the term palliative is something that maybe many of our listeners are not familiar with. They have one vision of what hospice does.
Correct.
But could you give us the difference between hospice and palliative care?
Sure. So palliative care and hospice are both focused on quality of life. They're quality of life focused. The difference is palliative care can be provided anywhere throughout the patient's trajectory of illness. The patient does not even need to have a terminal diagnosis to be on palliative care, whereas hospice care by definition is care if the patient were to be expected to have a prognosis of 6 months or less.
Very interesting, and I don't think many of our listeners really knew that you did that. So I'm very glad you're here today to make that distinction. So in terms of palliative care, can you give us some examples of what some of those illnesses might look like? And I think that'll really resonate with our listeners.
So the biggest one really is patients with cancer. It's actually part of the 2017 American Society of Clinical Oncology and National Comprehensive Cancer Network guidelines that patients at time of diagnosis with stage 4 cancer also be offered a palliative care consult. In addition, patients with congestive heart failure, so cardiac diseases that may have progressive illness, emphysema and other lung diseases, patients who have had strokes, and patients with dementia. Those are really the big areas where palliative care can make a great impact from a quality of life perspective. There's numerous studies that indicate that patients who receive palliative care not only live better, but also live longer.
Well, I know you're a great partner with us, and
Thank
our
you.
Department of Aging and Disabilities makes a lot of referrals for those chronic illnesses. So thank you for that service and making that distinction. Now, one might ask, well, I'm already seeing a specialist. Why would I need to call Hospice of the Chesapeake for palliative care?
Sure. So again, palliative care can right-size the care. If you think about care in this country, about a third of care is non-beneficial or futile care, and palliative care can really help optimize the care that patients receive. From a quality perspective, not only quality of life, but quantity of life, and to manage those symptoms that their other doctors may have difficulty managing, whether it's pain, shortness of breath, nausea, debility, lack of appetite, depression, and also help the family cope with the patient's illness. And again, right-size that care, provide appropriate supports for the patient and family to help them get the most out of life and the best length out of life.
So important. And you mentioned family and family caregivers and how you blend everybody together for the best outcome.
Correct.
So the big question then becomes, how is palliative care paid for?
Sure. So palliative care is paid for. We're paid just like any other doctor is paid. So just like a patient would go see a cardiologist or a pulmonologist or an oncologist, we are paid for by Medicare, Medicaid, or other private insurers the same way, just as they are. So we are covered by just about every insurance out there. And again, this is something focused on the needs of the community.
Very good. Okay. So now where is this care provided? Does someone have to make an appointment to see a palliative care specialist?
So we do have appointments. We see patients at home, in nursing homes, in assisted living facilities. We also have a newly opened ambulatory palliative care center. So an office that's based in the community, just like you would go to see your primary care doctor, that's located in our campus on Pasadena. The Hospice Palliative Care Center, again, this is provided by the community, by donors living in our community that see the importance for this. We do need appointments, and again, any physician or provider that the patient is seeing can provide a referral or for us to see that patient. For more information, please contact us at support@cpmedicine.org or call 443-837-1525. As Pam had mentioned earlier, we are an institution of community. We've been serving the Anne Arundel community for 40 years now. It's our 40th anniversary, and look forward to continuing to provide high-quality care to the communities that we serve.
Excellent, and that's a beautiful campus that very peaceful and serene in Pasadena. I've been there several times. So you've been listening today to Pam Jordan, Director of Aging and Disabilities, and Dr. Eric Bush, who's the Chief Medical Officer of Hospice of the Chesapeake. If you have any questions about today's show, or if you're interested in any of our programs, please feel free to contact the Department of Aging and Disabilities at 410-222-4257. TTY, you can reach us through Maryland Relay 711, or you could visit us online. Please remember to follow us on Facebook. And again, this is Pam Jordan from the Department of Aging and Disabilities, and you've been listening to Senior Scene on your hometown station, 1430 WNAV.